So today I ran into a video and I thought I'd comment about it.
If you have been diagnosed with retinopathy already, I'm so sorry, because it is a very unpleasant thing. It's a very worrying thing to experience.
I totally agree. This person has type 1 diabetes. They have a whole lifetime ahead of them and they're looking at the brink of going completely blind, let's say, asking themselves, do I need to know this retina specialist my whole life? This is a lot to consider.
I was diagnosed with proliferative diabetic retinopathy, so I talk all the time about please do not put off your appointments, please take care of your eyes, don't ignore it because the situation will get worse.
This is the common thread in people who have diabetic retinopathy, particularly the advanced form. People are told you have diabetes, you need to look after your eye in addition to everything else. And I completely understand it. I'm not trying to make anyone feel bad, but a lot of people say, oh, forget that, my vision's fine. But then later on, at some point, the eyes start to fill up with blood. There's a lot of people losing a lot of vision and they realized, oh yeah, that's right, I forgot my eyes. And then they realize, wait, if my eyes don't work, how do I drive? How do I function? How do I get to my other doctors to help me with my diabetes? The eyes really are a fundamental part of the problem.
It's obviously unpleasant having injections into your eyes. It's not a nice experience. For me, it might be different depending on which hospital you go to or where you're based, which country you're based in. But it's almost like a little operating theatre that you go into. There's a little room attached to that you'll go in first. They will do some anaesthetic drops in your eyes and then put the dilating drops in your eyes, like the stingy ones. If you've had eye screening, you know which ones I'm talking about. The ones that dilate your pupils and they sting a bit. And then you go into the operating theatre and lie down. They clean you up, use like an iodine wash on your face. They put a sheet over your eye with like a cutout in it, and then they will sort of clamp your eyes open. Nothing painful, it's just to like hold your eyes open because obviously you don't want to flinch, you don't want to close your eyes as they're trying to do it. They will put more drops in your eyes and then they will make sure that your eyes are nice and numb and that it's not going to hurt, and then they will do the injection. You just have to try and focus on something in the room and keep looking at it and try not to move your eyes.
Whenever I hear about people who don't live in the United States, like this person lives in the United Kingdom, undergoing an eye injection, I feel like I need to say, pause. This is actually done many other ways. You don't have to go to a theater, to an operating room. Actually, in the United States, we do it in the clinic. The other way that she's describing this eye injection, she says they put a clamp in your eye to hold it open. I don't actually do that. She says they drape your face. That is, they put like a big covering so that only the eye is revealed. I don't even do that either. You might say all these measures are meant to prevent infection. Well, the rate of infection in the United States versus other countries is basically identical. I'm not trying to start a conflict or be critical of people. This is a fine way of doing an eye injection. Obviously it is, because their patients are doing well in the United Kingdom. But the point I'm trying to make is, if you're an American audience listening to this experience, you might find it's rather different. The way an eye injection goes for me, at least in my clinic, what happens is that we place a little numbing drop on the surface of the eye, we let that simmer for a minute, and then I place a little bit of lidocaine just on the surface. At that point, someone feels a tiny little pinch. And then we lean you back in the chair like this, you look up, I grab the eyelid after putting a little bit of anti-infection eye drops, things that prevent eye infections, sit there for a while. I hold the eyelid, you look up, you feel maybe a little push, and we're done. One of my most favorite things that people say after an eye injection is, did you do the eye injection? Ooh, I love that.
You probably will get a little bleed when you get it done. As you can see, I probably have a few marks in both of my eyes. They were just done this morning, so it's fresh, brand new. Your eyes will probably feel a bit stingy for a couple of hours afterwards. You might be a bit sensitive to light for the rest of the day.
So what she's referring to here is that she developed something called a subconjunctival hemorrhage. This refers to a little bit of bleeding that can happen on the surface of the eye. It may not happen every time. It happens in my clinic. Any place that does eye injections, our patients will experience this. It can be a source of a lot of consternation for people. People get really worried when their eye looks red, and I totally understand it. It doesn't look natural at all. The eye looks really ugly. People always ask you, loved ones, neighbors, etc., what's up with your eyes? Why do they look so red? People ask, are you okay? Are you going blind? It's up to us to explain it to them. Actually, I had an eye injection. This is totally benign. In fact, it's like a bruise. It'll go away, no problem. I have some patients who lose a lot of sleep over this, and both me and this patient can assure you it is no big deal. She also says the eyes are sensitive to the light afterwards, which makes a lot of sense too. If you're putting a bunch of things on the eye, kind of irritating a little bit, then by virtue of that alone, the eyes are a little sensitive. And of course, we dilate the eye so that we can examine it before we do an eye injection. And anytime you dilate the eye, it's always a little sensitive to the light. It's true. I love it when people who have this condition share their experience, because when people talk about what happens to them, I think people start to realize this is actually okay. That is, if we just think back to the beginning of this whole conversation with this video, initially there's a lot of anxiety and suspicion, like I'm going to go blind. But actually, if you live through it long enough, if you get enough eye injections, undergo laser surgery, etc., you realize at some point we're going to get really good control over this. I tell all my patients with diabetic retinopathy, particularly the proliferative form, that we're best pals forever. I really mean it. Sometimes the retina specialist sees a patient with diabetes more than their endocrinologist or family doctor. And it's because we're dealing with this life-changing, life-altering diagnosis. We got to work really hard at it.